Hi, everyone. Welcome. Saturday, June 28th. It's about 11:05 here in New York City on the East Coast of the United States. Welcome, everyone, to this webinar. I'm going to share my screen. I'm also going to share my sound and video because we're going to have some video coming up later. And away we go. Welcome all of you. I know some of you here in the United States and some of you are global. Obviously, we have a global community here. Jeremy and I are going to talk about treating both the mind and the body, or the brain and the body, as a mental health physical therapist. The webinar probably will be about 30 to 40 minutes. We're going to go over some research. We're going to go over some educational opportunities, and we're going to talk about why this is important for us individually. And we think that'll kind of hopefully spur something in you as well, because everyone who comes to this either has something that is personally driving them, or obviously something very strongly that's professionally driving them. So obviously, just some quick objectives. We're going to identify different types of physical therapy interventions that address mental health and promote whole person well-being. We're going to describe the mental health physical therapist scope of practice, and we'll point you to some educational resources in mental health physical therapy. And I'm going to hand it over to Jeremy really early here in the webinar. We're going to kind of go back and forth. Jeremy and I are going to, kind of make this a tag team event. So, Jeremy, I'll turn this over to you.
Great, thanks, Joe. Yeah, so we can open up the conversation today about starting with the state of mental health in the United States of America. So you go ahead and move forward, Joe. Thanks. Like I'm sure many of you are already aware in your clinical practices or your own personal experiences, you're not alone if you have a mental health illness or challenge. Millions of people are affected by mental illness every year. Across our country, 1 in 5 U.S. adults experience mental illness. 1 in 20 experience serious mental illness, and approximately 17% of youth experience a mental health disorder as well. So go ahead, Joe. There is a significant lack of treatment options as well as access to care for the majority of folks in our country. I exclusively work with veterans in my clinic, and these rates are about the same. So when we look at that, about half of adults with a mental illness never receive a treatment for their mental illness. I think that's pretty fascinating. Now, they might receive treatment for their physical ailments, and they may show up in your clinic with a physical ailment, and they may already have these mental health treatments that are being untreated or unmanaged. This is about 100, or excuse me, over 27 million individuals, and the prevalence of untreated adults with mental illness ranges from 42.6% in Vermont to as high as 67% in Hawaii. I live in the southeast part of our country, and you can see that those rates are very high. So, next slide, Joe. So, with all of the mental illness, who is there to be able to care for folks? And currently, we have a problem with that in our nation. We have a workforce availability issue. So, 150 million people live in a mental health workforce shortage area. I live in probably one of the worst states in the country, in Alabama, in Mobile, Alabama. Um, and there is a deficit overall of about 300,000 mental health providers. And this data does not account for whether these providers can accept patients, are accepting insurance, or providing in-network care, or they're closely representative of their community or are retired. So what that really tells us is you have many people in different areas of the country who need help, um, but there aren't really people who are culturally competent or aware. A lot of mental health providers do not accept certain insurances, and so that leaves a pretty significant gap. And then there's also a need for more mental health providers as a whole. So I'm sure you're experiencing a lot of that. This was a great study that was recently published by Trevor Lentz et al. And it really showed this self-reported disability trajectories and their predictors among patients receiving care by physical therapists for musculoskeletal conditions. So they actually took a look. I think it was, I can't remember exactly how many clinics it was, but there were nearly 600,000 outpatient PT. Those were unique encounters too that were analyzed. So the generalizability of this study is tremendous. Um, they showed that most people do go on to experience some change, and that about 5% showed significant worsening of their problem. And that really the predictors, and I think we've known this for probably the last 15 years, that the predictors of outcomes in, especially this is an outpatient setting, outpatient physical therapy, are in the psychosocial area. So people that have lower mental health scores on initial onset of care, they use something called the social deprivation index to describe the social determinants and their social environments and social supports. Those people that have lower social deprivation scores, and then their insurance status also predicted poor outcomes. So, just another really great study that shows that, hey, if we're going to be working toward improving outcomes for people, we probably need to be addressing their mental and social health. Joe?
Thanks so much for that great intro, Jeremy. Um, Obviously, Jeremy just showed some very recent evidence, right? But if we think back to our origins, at least in the United States of America, and I believe this is true around the globe, is that in many ways, physiotherapy or physical therapy is actually rooted in mental health care. Back in about 1912 to 1920, when World War I was going on, we were known as Reconstruction aides or reconstructive aides. And we helped soldiers recover from obviously their physical wounds, but also something back then that was called battle neurosis. Now, we don't use that term battle neurosis anymore. The term we use is post-traumatic stress disorder. And it was the responsibility of both physical therapists and occupational therapists to help people not only with their physical wounds, but also the emotional wounds that they experience. This is the roots of our profession. This is how we started. We were there even before most mental health providers were there. We were treating these patients, and we still see them today in our clinic every day. And I'm not going to go through this one by one, research by research, but we have systematic reviews, we have meta-analysis, we have expert opinions on the unique and strong role that we can play as physical therapists in helping people either with comorbid mental health conditions or directly with their mental health conditions. And you can take a screenshot of this and read through some of these, but again, this research has been out there for, as Jeremy said, probably close to 15 years. So we're aware of it. I think we're just now getting to the point where we're sharing it more broadly. And as we start to share it more broadly, what has happened is there's a creation of this unique practice area called mental health physical therapy. And we look at this as treating the whole person. So not just treating their mind and not just treating their body, not just taking in the social context, but really bringing it all into patient care. So when we look at mental health physical therapy, it is a specific physical health approach. It could be a psychosocial approach, or it could be a specific psychotherapeutic approach. And I'll go through all three of those so you have a better idea of what they are. So first, the physical health approach is something that we do naturally as physical therapists, right? This is our traditional physical therapy where we resolve physical impairments and we prescribe exercise. More recently, along with those physical health approaches, we moved into the lifestyle intervention approaches. And there's research now that recommends that if we're addressing behavioral and mental health, that what we should do first are the lifestyle approaches here at the bottom of the pyramid. That these often can be extremely impactful for people with behavioral and mental health challenges. Second is a psychosocial approach, right? So that's kind of the second level as we go up. This is what we kind of talk about in pain care. We consider the psychosocial factors, right? The psychological factors or the social factors that have an influence on pain. And we want to prevent, obviously, those factors from turning into full-blown mental health conditions. So here, we're focusing on the prevention of a mental health condition. There's also a specific psychotherapeutic approach. So that's where you, as a physical therapist, are utilizing low to moderate intensity psychological techniques to target either a mental health condition or mental health symptoms. So those can be cognitive techniques, they could be behavioral techniques, they could be emotional techniques, they could be somatic techniques. You could use those in combination with the other things that you're doing, or there may be a place to use those alone as part of your treatment or as your direct treatment. Let's just switch to scope of practice or move to scope of practice for a minute. In the United States, and I'm sure this is common for many parts of the world, we have a professional scope of practice, we have a state or what's called a jurisdictional scope of practice, and we have a personal scope. Our professional scope of practice, first of all, in most jurisdictions, physical therapists work as entry point or primary care providers. This is obviously a statement released by the American Physical Therapy Association. So we possess clinical expertise in the prevention and management of common health conditions seen in primary care settings. Obviously, that would include mental health conditions. There's also a separate House of Delegates statement on the role of the physical therapist in behavioral and mental health. And if you kind of scroll down here and look at this, it is within the professional scope of physical therapist practice to screen and address behavioral and mental health conditions for patients or clients. We have state practice acts. Every single one of our state practice acts mentions that we can treat disability. Disability, as defined by the CDC, is a disability of any condition of the body or mind, right? An impairment of the body or mind. There's no separation of that, right? We bring this together. Finally, there's your personal scope. So your personal scope are the activities for which you have been educated, trained, and are competent to perform, right? So have you received education in this area? Have you received some kind of specific training in mental health physical therapy? And have you been tested? Are you competent to perform this, right? So each of us has our own unique personal scope that changes and grows over the course of our career as we take different types of education, certifications, training programs. I believe the personal scope is the one that's most important when you're working in this area. You could be really excited and know how important mental health is, but if you don't have some type of solid evidence-based training, I don't recommend you move into that area. Obviously, you need to have some type of education and training. So this is where you ask yourself, do you have skills to improve in this specialty area? Have you completed any type of mental health training? Do you have proof of competency as a mental health physical therapist? And these are questions that Jeremy and I still ask ourselves to this day as we grow and learn more and more about mental and behavioral health. And these are questions that we have talked about, both Jeremy and I, together really for, at least the past year, if not 2 years. And what we decided was that we really need to create a certification program and bring some of this knowledge to physical therapists, physical therapist assistants, and other licensed health providers who may be interested in learning this. So we created a specific certification. So I'll tell you about that certification now. The certification will teach you the physical, cognitive, behavioral, emotional, and somatic techniques that optimize mental health. It's approved for 32 CEUs, both for physical therapists and physical therapist assistants. Before we go into the specifics of the certification, I want to share with you some of the stories about some of the PTs and PTAs who have been through the program and what they've experienced. We're now about to open our third cohort. So we've been through two cohorts of the program. We have made significant changes and improvements to it, and we're about to open our third cohort. But I want to share with you some of the stories of the PTs who have been through the certification.
Doing this course definitely kind of allowed me to really step into that role as someone who does integrate mental health and physical health.
This process for me has been reaffirming we can do this. So we need to do this for our patients because we need to treat them as a whole.
Participating in this, I feel more empowered and relaxed to be able to practice the way that I always intuitively practice.
It's been really very eye-opening. So thank you guys.
This course has been so helpful to me. Before I was just documenting the actual PT stuff. Now I'm documenting the mental health aspect, and I just feel like it's been, as Jeremy said, transformative for me, for my patients.
There were these moments when I didn't know how to intervene, and now instead of being just a listening ear and empathetic, I feel like I have more of an opportunity here.
My patients love that I'm addressing the physical alongside their emotional and psychological health. I'm using these skills in the clinic as well as in telehealth appointments. It feels a lot more rewarding to address not only the biomechanical, but also the psychosocial aspects of care.
Actually having tools that are within our scope and our role to utilize is just so needed and empowering, I think, as a PT.
PTs don't know how to screen, and then they don't know how to intervene, which I think is exactly what you guys have brought to us here, and it's been great.
What I appreciate and am excited about is that ability through the work that we're doing in the modules is to be a bit more introspective in how we're coming to the table to meet someone where they are.
This course has been truly transformative for me and for my patients and the community that I work in. Very excited for to bring this into my practice within this framework and take it forward from there.
I realized that there were component parts where I was ineffective, and I appreciate that this is filling that gap.
I could not be more grateful that you wrestle with the standard of hard lines. This is a physical therapy. I love the wrestling. I love the pioneer spirit that you guys have, and being a part of that has been really, it's really been transformational.
Physiotherapists, I haven't seen any courses like this, so it's really innovative and transformative in the way we view ourselves as physios, and I think it's a huge step forward for the profession.
I think physical therapists really are the best profession to treat the whole person. So those are some of the people that you'll meet, or people like that, when you join the mental health physical therapist certification. As I mentioned, we've had 2 cohorts. So just a flavor of some of the incredible physical therapists, really through almost every practice setting, have joined the certification. This certification has 3 components. The first component are mental health foundations. So you'll learn foundational skills of identifying, screening, differentially diagnosing some of the more common mental health conditions. Then part 2 of the certification, we go into the mental health essential skills. Obviously, you're going to learn here cognitive, behavioral, emotional, somatic, and other physical skills that improve mental health and mental well-being. And then the third part is mental health mastery. So this mental health mastery part is a 1-day live online training where you work with Jeremy and I and your colleagues to practice the skills, right? So once you've learned the skills, it really is helpful to practice and to connect with other physical therapists who are using these skills in practice. So that's, in essence, how we break up the 32 hours of the course. So I'll kind of give it to you here again. So there's the foundations. That's about 8 hours. There's the mental health essential skills. That's about 16 hours. Both of these are self-paced, so you can go through this on your own. We don't have a specific time frame. We do, however, have the mental health mastery program, or the mental health mastery day, I should say, which is on October 4th. So we give you a couple of weeks, obviously, to work your way through the content, a couple extra weeks to catch up if you fall behind. And on October 4th, we're all going to come together to obviously work together to work on the mental health mastery of things. There are case-based learning, there are discussion forums, there are patient simulations, community forums, support and mentorship. We have made this really digestible, short, it's focused. We have, after 2 cohorts, figured out how to deliver this in the most efficient and effective way possible for physiotherapists, physical therapists, and other health professionals. This is something that Jeremy and I kind of live by. So we think that, or we believe, trauma creates change that you don't necessarily choose. And part of healing trauma, which Jeremy and I both have, we'll tell you about in a minute, is we get the ability to create change now. So there are things about us. So Jeremy and I both have lived experience of mental health challenges that we have kind of infused into the certification program. And that's important because the latest research shows that people with lived experience should have or should be a part of the educational narrative. Evidence supports that. So obviously, we're pulling from the evidence, of course, but we're also adding our lived experience of dealing with mental health conditions on our own, and navigating the mental health system, sometimes avoiding the mental health system because it may have not been so effective for us. So, we live this work, which is why we teach this work. I overcame depression early on, kind of in my early 20s, and Jeremy has overcome PTSD, and we have both grappled multiple times with clinical burnout. And we know what comes along with burnout, right? That emotional exhaustion, secondary trauma. So it's really important that we can bring this lived experience to you as well. And with that, I'll turn it over to Jeremy, and he can tell you a little bit about where he's been and where he is today.
Yeah, thanks. Thanks, Joe. I appreciate that. Yeah, so I think when I reflect on why this matters to me, um, Joe's pulled up several images here that describe a little bit about my story. As a physical therapist who's now working within the Veterans Administration and working with veterans, there's common themes that emerge from many of the stories that I hear on a day-to-day basis, and I really feel like that my life has, in many ways, reflected those common themes. And I think some of those common themes are really that many of the struggles that veterans face, those existed prior to their service. And they come from these really difficult environments. And I'm one of those people. So I grew up in one of those mental health shortage areas that you saw on the map in Baton Rouge, Louisiana. And I grew up, my parents were divorced by the time I was 5. My mom, who I thought about integrating into this, but there's a lady with the Dolly Parton hair kind of thing going on there, if you see that. She had a lot of struggles with depression and mental illness and chronic pain and fibromyalgia, and really just wasn't able to be an effective parent for my brother or my half sister. And so she did the best she could, and really my father, I think, left us primarily because he didn't have the skills or abilities to cope with her challenges as well. So that left me with a lot of experiences. One of those is just kind of a core fear of abandonment that I had to work through and still work through to this day. Um, yeah, and fortunately, I was blessed with some intelligence. I was also blessed with some athletic ability, and that led me to finding some safety for myself within playing baseball. I was a pretty good athlete and became a collegiate athlete, played baseball in college. And somewhere along the way, I was blessed with also with my wife, who really gave me a whole different purpose for living at that time. And because of that relationship with my wife, we were able to choose our path forward together, and it's been an adventurous 25 years, July 15th, actually. Um, and so out of that marriage, we decided we wanted better for ourselves. Went back to school. I actually enlisted in the military first. I was a physical therapist or a combat medic, and then I got an additional skill identifier to be a physical therapist assistant in the military. And then I became I decided I want to get out, go back into the Army Reserve, and then I became a physical therapist. And after that, my oldest daughter at that time, she was on the autism spectrum, and we needed healthcare insurance because like like you saw in that map earlier, there's not a lot of coverage for ABA therapy at that time. So the military did provide that health and care insurance for us. So I joined the military, went on active duty as a physical therapist. Um, I served in a role primarily in an outpatient clinic, became extremely interested in these psychosocial factors after reading a lot of Stephen George's work initially back in 2010. And really found out, oh, wow, by the way, I'm really just researching myself here, is I think what I found out along the way. I had a good buddy who's a clinical psychologist, and He tells me research is me search. And I'm like, oh, so that's why I'm digging into all this stuff so much. So it was, very enlightening experience. And then, so I did deploy to Afghanistan in 2013 with a 4th Light Infantry Brigade combat team. And so had an experience in a combat zone. My role there was primarily to fly around the hills of Afghanistan and the different combat outposts and outposts to care for folks. Made some great relationships, lost some folks along the way during my deployment, but most importantly, the only real stable figure I had in my life was my grandfather, and he passed during that period of time as well. So a lot of grief, a lot of loss, and then a really hyperactive nervous system that had really driven me to learn that the way that I can find affection, love, and attention that I didn't receive as a child was just to achieve things. And that wasn't probably the healthiest way to go about doing that. So that led to me being burned out, which is what you see on that medication list over there in that picture on the right there was yeah, that was the moment when I actually had a really severe sinus infection. My immune system was shot post deployment, and went into my primary care provider, and they prescribed me some systemic steroids, and I started having suicidal ideations, and it was pretty bad. I remember calling him up, and he said, "Yeah, remember how I told you were going to get these Ben and Jerry cravings?" I was like, "Ben and Jerry, dude, I'm having thoughts about killing myself." I was like, I think it's a little different than that. The bottom line was they didn't identify that I had post-traumatic stress disorder. I had some of these other issues going on. And so fortunately, I was able to make it and overcome that situation by reaching out for help. I went to our behavioral health team, psychiatrist, started on some medications, and then started some behavioral counseling. Um, Also went through a veteran retreat experience, which was really transformative for me, and still continue to do work on myself to this day. I still have, and it's been about 10 years that I've been working on different things. Um, so that's why I'm here. And I've taken that work for myself. I brought it into the veteran community, extensively. Um, I actually got a really large grant through the Robert Wood Johnson Foundation, myself and a team, and we developed a an organization called Veterans Recovery Resources to help address the deficits in substance abuse and mental health across the Gulf Coast. And yeah, I've since left that position. I made it up to the chief operations officer of that organization, left that position to go back into the VA. And yeah, Joe and I over the last 2 or 3 years have been talking about how do we make meaning and purpose out of the things that we have dealt with, and this is how we do it. So, Joe, appreciate you allowing me to share my story.
Thanks, Jeremy. Every time I hear Jeremy's story, I just look at his whole journey and, from where he came from as a, kid and adolescent and where he is today. I think it's just so inspiring and seeing him speak, because I speak with Jeremy every year at CSM, and he always wows the crowd because he's such a role model for our profession. I have a different, but maybe in some way similar story to Jeremy. Many of you know that June in the United States of America is Pride Month. So this is where we celebrate people who are queer or coming out, so to speak. In 1998 that's a picture of me up there on the upper right-hand side with that luscious full head of hair, which I still wish I had. But my mom snapped a picture of me on the couch one day, and she said, "Why do you look so sad all the time?" And the reason why I looked so sad is 'cause I was carrying this really heavy weight with me my entire life. And when I got to the age of about 21, being in the closet really became detrimental to my mental health. And I started suffering from depression. And the depression really got to be so bad that the reason why you see a bridge there, that's the George Washington Bridge, which connects Manhattan to New Jersey, is that I started having ideas and thoughts and making a plan of jumping off the George Washington Bridge. So this is about 1998. I slowly started coming out to friends and family, and there were some people that were really incredibly supportive, and there were some people that, of course, weren't. And this is what we face as, queer people. There's also another part of my story that during that time, there was an awful public policy, which was called "Don't Ask, Don't Tell." It was a policy in the military, which said that you could be queer if you're in the military, but you can't tell anyone. So in many ways, it was keeping people closeted and, of course, affecting their mental health. Um, right around that time, I met my first gay friend in New York City. His name is Bill Westmoreland, still a good friend of mine. And he just really took me under his wing. And he's about 18 years older than me, and just introduced me to men, gay men and women who were healthy and resilient, and they were successful. And some of them had overcome the most incredible odds. And what I want you to take home from this story is that it only takes one person to help someone who's really struggling with their mental health. And it doesn't necessarily have to be a mental health provider. It can be you as a physical therapist who allows that person to be seen and to be heard and starts that process for them. And the coming out process is actually a really incredible euphoric process. You feel really good. Coming out in general feels really good. And then you start to look at the social environment that we're embedded in as queer people, somewhat in the United States of America, and you realize that there are social and political policies that have an impact on our physical and mental health, sometimes negatively. So there's always this balance of, I'm so excited to live the life that I have, but I'm also sad that there may be people who are younger than me, children, adolescents, who don't have support. And we want to be here, obviously, to support them. So that's why I do the work I do. I think you'll see there's lots of overlaps between mine and Jeremy's story here. We are tracking data. So people who come through this certification, we're obviously tracking the data to see what they think of the course. Do they like it? Are they using it? 95% of participants report an improved understanding of strategies to address mental health, and 100% recommend the course to one of their colleagues. Just some testimonials here. Sharon Pellman is a physical therapist who works in a homeless shelter. And she says, this course has been so helpful to me. She's now documenting mental health, and it's been transformative for her and for her patients. Alex Japit is a physical therapist who works with long COVID and chronic pain. And he says his role as a physical therapist has really changed. He's not only addressing, obviously, the biomechanical or the biomedical, but also the psychosocial. Tina Wellsom is a physical therapist. She's also a full-time educator. We have lots of educators who've come through the program. And she says that obviously now we can learn to screen and intervene. Rachna Mehta is a physical therapist in New Jersey. She has a really interesting practice where she weaves in, Western principles and Eastern principles along with everything that she's learned, obviously, in our certification program. Sarah Conover is a physical therapist who has really branded herself as the dizzy coach. And she's working at the intersection of chronic pain, dizziness, and anxiety. Really interesting practice area. Sarah Case Morris is another full-time professor at the University of Michigan in Flint, and she has used a lot of our teachings to implement into the health and wellness course and the pain management course in the DPT program. And then Chase Belote is a physical therapist in San Diego who's using what he's learned to help inform the multi or interdisciplinary pain clinic that he works at. So lots of great stories of people that have come through, obviously the first and second. The link is there to join. You can pay in full, or you can choose a 3-month payment plan or a 6-month payment plan. Obviously, the certification enrollment period is open today. And run through the CEUs, run through everything really that you have here. I'll just kind of leave that up for you to take a look at. We would love to work with you. We would love to meet you and, really support you on the journey that we've been through and kind of bring you on that journey. We all really need to lift each other up. And that's one of the things that we focus on here in the certification. All right, if you have any questions, you can reach out to me. My email is easy, joe@integrativepainscienceinstitute.com. I do respond to emails well. It's been a pleasure spending this time with you, and we look forward to working with all of you in this third cohort of the Mental Health Physical Therapy certification. I know there's something special here for you. Your practice is going to change. Your ability to help people is going to change, and I really believe we've seen tremendous personal transformation happen by the end of this certification as well. So we're excited to work with you and to go on this journey with you, and we'll see you soon. All right, everyone, take care.